heart disease? Cardiovascular disease or CVD. Understanding how the heart works. The heart is the hardest working muscle in the body. The average heart beats 100,000 times a day, day and night, to supply oxygen and nutrients throughout the body. Blood pumped by the heart also shuttles waste products such as carbon dioxide to the lungs so it can be eliminated from the body. Proper heart function is essential to support life. What is heart disease? Coronary artery disease or CVD, commonly known as heart disease, is a condition in which cholesterol, calcium and other fats accumulate in the arteries that supply blood to the heart. This material hardens, forming a plaque that blocks blood flow to the heart. When a coronary artery narrows due to plaque buildup or some other cause, the heart muscle is starved for oxygen and a person experiences chest pain known as angina. The link between heart disease and heart attack. Sometimes a piece of a fatty plaque in a coronary artery breaks off or ruptures. When this happens, a blood clot forms in the area in response to the injury. The clot may block the flow of blood through the artery, causing a heart attack. Sadly, some heart attacks lead to the heart stopping completely, a situation known as sudden cardiac arrest. The heart may also start to beat in a very dangerous rhythm called ventricular tachycardia, which is potentially fatal. What are the risk factors for heart disease? Certain risk factors increase the chances of developing heart disease. More common heart disease risk factors include 1. High cholesterol. 2. Diabetes. 3. Heart disease in a close blood relative. 4. Obesity. 5. High blood pressure. 6. Smoking. 7. Peripheral artery disease or PAD. What are lifestyle risk factors for heart disease? Certain lifestyle factors and choices increase the risk of heart disease including 1. Eating a diet high in fat. 2. Being type A, impatient, aggressive and or competitive. 3. Being physically inactive. 4. Experiencing emotional distress or being stressed out. Cardiac death, a fatal consequence of heart disease. Heart disease symptoms differ from person to person. Those who experience chest pain or shortness of breath have a chance to receive life-saving treatment in a hospital. For others, unfortunately, sudden cardiac arrest and death are the first symptoms of heart disease they experience. What are common symptoms of heart disease? Many people with heart disease notice symptoms during physical exertion or exercise. The heart needs more oxygen and nutrients during physical exertion, so people with heart disease may notice symptoms when they are active. Symptoms of heart disease may include 1. Jaw pain. 2. Chest pain. 3. Back pain, typically left-sided. 4. Shortness of breath. To other symptoms of heart disease. Symptoms of heart disease may also include 1. Nausea. 2. Lightheadedness, dizziness. 3. Abdominal pain. 4. Irregular heartbeat. 5. Weakness, especially at rest. What are the heart disease symptoms in women, seniors, and people with diabetes? Certain groups of people with heart disease experience atypical symptoms. Many women, people with diabetes, and elderly individuals do not experience pain as a symptom of heart disease. People in those groups are more likely to report fatigue or a general feeling of malaise as a symptom of heart disease. What is an electrocardiogram or EKG? Electricity flows through heart cells to stimulate contraction of the heart muscle. People who have heart disease have hearts that do not conduct electricity normally. An electrocardiogram or EKG or ECG is a quick, painless, non-invasive test that assesses the electrical behavior of the heart. An EKG is able to detect many heart conditions, including 1. Current heart attack. 2. Past history of heart attack. 3. Heart rhythm disturbances. 4. Blood electrolyte abnormalities. 5. Unstable angina. 6. Congenital heart defects. 7. Conditions involving cardiac inflammation. What is a stress test? Symptoms of heart disease are often present during physical exertion because the heart is stressed and doesn't receive sufficient oxygen and nutrients. A stress test observes the behavior of the heart while the patient is walking or running on a treadmill. The patient is hooked up to an EKG machine to detect the heart's activity before, during, and after the stress test. The test is 60% to 70% accurate in detecting blocked coronary arteries. Sometimes a patient may be too weak or deconditioned to perform a stress test. In that case, the doctor can administer medications that simulate the heart activity during exercise. The patient remains stationary. The doctor may also use nuclear imaging or ultrasound to visualize the behavior of the heart. Lifestyle changes. Using alcohol in moderation and quitting smoking. Controlling your alcohol intake and avoiding smoking are two easy ways to reduce the risk of heart disease. To optimize levels of HDL good cholesterol, women should have no more than 1 alcoholic drink per day while men should have no more than 2 alcoholic drinks per day. A person who smokes and then quits reduces his or her risk of heart disease to the level of that of a non-smoker 3 years after quitting. The risk of heart disease with exercise, aspirin, and by controlling high blood pressure and diabetes. A few simple measures can help reduce heart disease risk. Speak with your doctor before implementing these measures to make sure they are safe for you. Daily low-dose aspirin therapy has been shown to reduce the risk of heart attack. Exercise for at least 30 minutes 3 to 5 days a week to optimize blood lipids, lowers bad LDL and raises good HDL, cholesterol, lower blood pressure, and strengthen the heart muscle. If you have diabetes or high blood pressure, or both, control them. High blood pressure and high blood sugar are damaging to the heart.